These are some of the ones that we commonly use. Bentyl, B-E-N-T-Y-L, or dicyclomine, D-Y-C-L-O-C-O-M-I-N-E, Donatol, Librax, Pamine, Levsin, Anaspaz, Rubinol, and we're going to talk a lot more about probiotics later. Again, these are antispasmodics, and many of these work in a very similar fashion. So after in addition to the antispasmodics that we just reviewed here a minute ago, these are prescription medications, except for the probiotics. In addition, we typically will also suggest anti-flatulence to help reduce the gas and the bloat. And basically, these are made up of either charcoal or simethicone. And some of these names are Phazine, Mylicon, Gas-X, Beano, Chococaps, and again, probiotics to address the gas and the bloating. And if dairy intolerance is present, and again, this can be seen in up to 30 or 40% of patients who suffer with IBS, Lactaid or some of the lactase enzyme products that are over the counter, either in pill form or drops, can be used to reduce the gas and the bloating. Well, what about the bowel movement issues? Well, there's a lot of ways to try to address bowel movement issues. Unfortunately, as most of you who know about IBS, Zelnorm was recently taken off the market, or at least given a warning, and so we're left without that prescription medicine. But for constipation, there's milk of magnesia, Mylanta, lactose, fiber, metamucil or citrusol, prune juice, drinking lots of water, exercise. There is a prescription medicine called Amnesia that can be used for chronic constipation. Probiotics, and of course, now we're using in some cases polyethylene glycol, which is the liquid medicine that frequently is used to cleanse the colon prior to colonoscopy in some patients to help again address severe constipation. Patients with diarrhea, we will sometimes use Imodium over the counter, Lomotil prescription, fiber, Equilactin, and probiotics. Equilactin is an over the counter product that can help sometimes regulate mild to moderate diarrhea. And then for the alternating diarrhea and constipation patients, again, Equilactin and probiotics. So the important goal with regard to bowel movements and bowel function is to understand that there is no absolute elimination or complete normalization of the abnormal stool pattern in IBS. We only want to help get the best quality of life and control we can with the least intervention and medicine. I can't emphasize enough the next point. If you suffer with anxiety or depression or insomnia, difficulty with sleep patterns, as we mentioned earlier, you need to see your doctor and get these under the best possible control. Whether it's walking on a beach or transcendental meditation, whatever it is that helps calm you and relax you and makes you feel good, those are activities that you should spend the time doing because they'll have a positive effect on your stress level and anxiety and depression issues, hopefully. And if anxiety, depression, and insomnia are present, you must address them with prescription medications in order to truly get the IBS under control. And that's usually people with the moderate or more severe IBS symptoms. It's important to clarify being treated with a medicine, but versus having that medicine be effective in controlling the symptoms. What I mean by that is lots of people who are suffering with IBS may be on a medicine for anxiety, depression, or insomnia, but they still have the anxiety, depression, and the insomnia, despite the fact they're on medicines. They're on treatment, but the treatment is no longer effective for whatever reason. And they may or may not go back to the doctor, or the doctor may or not be aware of that. And so if your symptoms, if those symptoms are not under control, despite you being on treatment, you've got to communicate that to your physician so that he can either increase the dose or adjust the dose or change the medicine or try, again, the goal is to get that under the best possible control, not just to put you on treatment and assume that it's working. You've got to communicate with your doctor. Okay. Thank you for bearing with me so far. Thank you. I want to take a moment here to mention the importance of the dynamics and the relationship of the patient with IBS and the family, the relatives, the spouses, the home, the immediate family. In most cases, spouses and siblings are suffering as well when their loved ones have IBS. Again, the more moderate to severe types. Their quality of life is also affected because they're looking at their loved ones suffering with frequent bowel movements, and they develop their own anxiety and frustration from feeling helpless and then going back to the doctor and going back to the doctor, and the doctor says everything's fine, there's nothing wrong, your colonoscopy was normal, the CAT scan was normal, your blood tests are normal, and meanwhile the individual is missing work, may not be able to participate in all the usual family functions, is getting up from the dinner table, can't go to a restaurant, is afraid to even leave the house sometimes.